Okay, I'm going to start talking because I have probably the least exciting material to get through this afternoon, but I do want to give some opening remarks and just share some brief thoughts about where we are right now and a little bit about the Ehealth Initiative. For those of you who are just joining us, we're going to give folks a moment or two to continue to log on. Good afternoon. I'm Jen Kovich-Bordenick. I'm the CEO of the Ehealth Initiative and Foundation. I'd like to welcome you to this wonderful program this afternoon where we're going to be talking about automation and AI in the age of a pandemic, COVID-19. And I think we're all dealing with this, continue to be dealing with it over the last 12 months and are learning more and more each day about how to get through this really horrendous time, but also learning a lot about efficiencies and how to reduce burden right now in medical practices. So we've got a great set of speakers with us here today. Lance Rondella, who's the founder and CEO of Shift Health, Austin Walters, who's the co-founder and managing partner at Springtide Investments, Patty Jones, director of Revenue Cycle at Southwest Spine and Pain, and Adam Rasmussen, who's the CEO of Valley Women's Health. And we've got some great discussion this afternoon planned for you, and you're going to hear all about Betty the Bot and wonderful how this was employed in a medical practice. So really exciting stories. Before we get to that, I want to just go through a couple of brief thoughts for those of you who are not familiar with the Ehealth Initiative and our work here in Washington, D.C. We are a small nonprofit and foundation focused on education, advocacy, and thought leadership all around innovation and technology in healthcare. And these last 12 months have just been a whirlwind of using innovation and technology to get through this crisis that we're in right now. If you go to the next slide. We are a coalition of organizations. If you don't see the name of your organization up here, it should be up here. We basically work with executives from across the spectrum of healthcare, payers, providers, labs, consultants, researchers, consumer groups, trying to figure out how do we put all the pieces together and connect to really improve care and the patient experience. And as well as make life easier for providers. We work in 4 key critical issue areas: privacy, virtual care, COVID, of course, and analytics, social determinants of health. And we've done a lot of work around artificial intelligence, which is why today's program is really so relevant to the work that we do. Next slide. For those of you who are not familiar, we have a slew of educational programs available online, free of charge, www.ehidc.org. This is just a sampling of some of the more recent programs that we've put on around our 4 core areas: privacy, AI, COVID, excuse me, and virtual care. And I encourage you to download these, watch them, share them with colleagues. We really want to make sure that in order to transform care, that we share and advocate and promote these new practices as best as possible. Next slide. I also want to tell you to take a look at 2 recent releases that we just came out in the last week. We released a consumer privacy framework for health data working with the Robert Wood Johnson Foundation and the Centers for Democracy and Technology. And we also just released a new report last week on virtual care delivery during COVID-19 and beyond. I encourage you to take a look at those reports and download them and share them. We usually release 1 or 2 a month, and these are just 2 pieces that I'm really proud of for our organization. Really working with a culmination of probably over 100 different organizations on the privacy framework, and several key organizations on the virtual care delivery report, United Healthcare, CVS Health, and Amwell. So some great material in there to share. Next slide. And a couple of important dates coming up. We've got our webinar today, which is really exciting. We've got another one coming up next week on information blocking rules with health information exchanges. We're gonna be looking at eligibility and formulary files on March 10th. And the case for a learning health system, lessons from COVID, on March 11th. And then we have a number of working groups we encourage you to join if you are a member of Ehealth Initiative. We've also got a great roundtable coming up, which is a group of executives who will be meeting to talk about virtual care and tribal communities. And we are looking right now for individuals and organizations who work with tribal communities across the country right now as part of the addressing the COVID-19 pandemic. So if you are interested in that, please reach out to myself through the chat box, and we'll be sure to get you included in that program coming up March 24th. And I really want to thank our sponsor today, Shift Health, and you're going to hear all about this from Lance today, but doing some really exciting things. And I think when you hear from Patty and others about how they've really employed this in medical practices, you'll see that this solution is just a really practical solution that fits into the workflow. And we all know how important the workflow is to making innovation technology work today. So I am excited that we have their folks here today. So thanks to Shift Health. And I am actually going to turn it over to Lance, who's got some great questions for our panelists today. So Lance.
Awesome. Appreciate it, Jen. And good morning, everybody. I guess everybody that's still in the morning on the Pacific Coast, and afternoon to everybody on the East Coast. I'm excited about today's panel discussion and roundtable. We've had a tremendous amount of interest for today's topic as we examine real-world use cases of adopting AI and automating our way through the pandemic. We are fortunate to have a fantastic group here representing some of healthcare's top leaders and innovative minds. They come with a great deal of experience as operators and implementers of intelligent automation and intelligent workflows. And they'll be sharing their journey of implementing AI during the pandemic and giving us kind of their insights into how that's going to roll out as we continue into 2021 and beyond. And so we'll be exploring each one of those use cases and hearing their stories. For those of you who are new to the world of AI, artificial intelligence, and how that applies to automation, when we use the term intelligent automation, we are referring to the application of AI to automate routine, mundane tasks that exist within an organization. And so you'll hear those terms used throughout the different use cases. So with that said, we're going to hear first from the panelists and hear their background and their unique stories, and then we're going to jump into a sort of a panel discussion roundtable, and we'll have some time at the end for Q&A. So any questions you have as we're going through this, please post those to the chat window, and we'll get to them as soon as we can. So with that, it's my pleasure to introduce Adam Rasmussen. Adam is currently serving as the CEO of Valley Women's Health. He has helped grow Valley to be one of the largest privately owned women's health specialty groups in the Mountain West. Adam has served on committees and been a board member at several organizations, including UHIN, Utah's Health Information Network. Prior to Valley, Adam was a partner at Granite Capital, private equity investment group. Adam is also a successful entrepreneur, startup advisor, and healthcare innovator. He holds an MBA from Duke. Adam, thanks for being with us today. We're excited to hear from you. Would love to hear and have you share with us a little bit about your 2020 automation journey through the pandemic and how 2021 priorities are starting to shape up for you and Valley Women's Health.
Well, I think when the pandemic hit, our first thought was, I hope that we're alive by the end of this thing. That was sort of the initial thought process. But I think our sort of journey within automation or technology started, before 2020, and I think it's sort of been enhanced because of that, or sort of maybe pushed more to the forefront and bought off by more people because of that. When we looked a couple of years ago for some solutions that would allow us to automate more of the sort of the patient end of it, like dealing with payments. And we're a women's health organization, pretty much focuses just on women's health. We do a lot of OB, especially in Utah. And as part of that, we were looking at how to manage our cash flows better and using technology and automation to do that. And that's where we bumped into Lance and found a solution that would allow us to, one of the ways that we manage that cash flow is when you're pregnant and you arrive at our office, we sort of figure out for you, all right, here's what insurance you have, here's what you're going to owe us roughly by the time you deliver. And so we'll help you out by allowing you to prepay for that over the 6 months before you actually deliver while you're visiting with us. And we're trying to find an easy way to communicate that with patients and an easy way for them to set up automatic payments and make that. And that's where Shift Health came in and helped us from an automation perspective, really make that work and make that happen and make it. The other thing that I like from an automation perspective is you can be more individualized is the word I think I'm looking for. So, instead of building like 100 widgets that are all the same, you now have the ability to build 100 widgets that all have some unique aspect to them. And you're not spending a bunch of time and effort to do that. The technology actually does that for you on the back end. So as we looked at that sort of scenario and started implementing that, then we said, well, why aren't we just allowing patients to pay their normal bills this way, versus sending them out either paper or an email? How can we make it easier for them to make a payment? And how can we get that information to them a lot quicker than, the normal process has sort of been patient sees you, you wait for insurance to pay. And then once they do, then depending on where their cycle hits, as far as their statement goes, they may not get a statement for another couple of weeks from that. And so we've automated that to where the moment that the insurance adjudicates that and it's in our system, you get notified that you have a bill. So we're lessening that time that a patient has to deal with that, and we're increasing our cash flow. And so as we started doing that, then we started looking at, well, some of the issue we have is getting insurance to pay because we have issues with not having the right insurance or not, or something along those lines. And so then we looked at, well, how do we improve our eligibility process? And so Shift Health again stepped in and helped us figure out how we can know beforehand where that patient is so that we can make sure we have the right information. So then we get our claims that are going out better. And then we looked at demographic issues and, having the right insurance cards and all of this stuff. And so as we look to the future, we sort of say, my philosophy is more like not what should I automate, but what can't I automate? And, because in theory, what we're trying to accomplish is we're trying to create an experience for our patients that makes it convenient for them to come see us and doesn't make it difficult and cumbersome for them, as well as what we're trying to do on our end is from an employee standpoint, allowing our employees to have more of that face-to-face interaction, that soft component with the patient, which is really what I need the employees to do versus them becoming the processor. And so I start looking for opportunities of where my employees processing stuff that's just mundane and repetitive. And it's stuff that I don't need them to be doing because I need them to be talking to either patients or insurance companies or whatever. And so when I think of AI, especially within the healthcare world, I think of what are those things that from a technology standpoint, we can automate that will allow us to take those employees instead of having more back office, pushing more front office to where they're actually dealing with people and people feel that there's that connection, because I think a lot of times that gets lost, especially as you get larger in a practice. So going forward, that's really what we're looking for. What are the different components or pieces within our process that we can apply AI to that allow us to improve everything we do? And some of that too is I think often when we think of AI, we think, oh, well, I'm going to have something come in and just take over a process. Where in reality, you might have a process that, includes all of these steps, but you're looking and saying, which pieces of those steps really are the ones that we can automate and which pieces aren't. And so within a whole process, there might be pieces that I can automate and some that I don't want to. And that's the beauty of AI, is it allows us to do that as well. And so, we're constantly looking for ways to improve there. One of the issues that we deal with as a health clinic is, it's no longer the world when I started that it seemed like every year, you know, insurance companies would increase the rate they paid you and everybody loved you. And now it's more like, well, what do the doctors do and why are we paying them so much? And so we always feel like we're getting sort of capped on the top side, but my costs continue to increase. So I've got to figure out, how do I maintain margins or improve margins as my top side may not grow as quickly as it has in the past? And I mean, one of the ways that to do that is to be able to do more with less. And really that's what AI is to me.
Awesome. Appreciate that, Adam. Any questions for Adam, let's go ahead and just post those to the chat box, and we'll answer those when we can during the panel discussion. If not, we'll get to them during the Q&A section. So appreciate it, Adam. So moving on to the second presenter, let me do a quick introduction to Austin Walters. Austin is a co-founder and managing partner at Springtide Capital, an early-stage venture capital fund dedicated to AI and healthcare. Austin himself is a serial entrepreneur, researcher, and sales leader in the health tech field. He's also passionate about supporting other entrepreneurs along his journey, serving patients and exploring new technologies. He holds an MBA from Harvard, and we're excited to have him with us today. Now, a side note, Austin, you bring a pretty unique perspective to the panel today. You're one of few individuals in the U.S. healthcare market who understand what's happening in this whole startup world of AI technologies that are just being incubated today and are being developed and groomed for application right now, here and now, as well as down the road, maybe 12, 24 months or 3 or 4 years down the road. So with that, would love for you to spend a few minutes sharing with us your perspective on the state of AI in healthcare, and maybe touch a little bit on the practicality component. So what's practical, what's impractical, and what does the future hold when it comes to AI?
Yeah. Thank you, Lance, and it's really good to be here. So I think the question of practicality in implementation and embedding within workflows is really, really important. And I would frame it perhaps as an issue of maturity with the AI. And one of the frameworks I found to be helpful in thinking about the maturity or appropriateness of artificial intelligence for this application or that application in healthcare is Clay Christensen's theories of disruptive innovation. And I'm sure that many of you in the audience have read his book, Innovator's Prescription, which applies his theories of disruption to healthcare. And one of the frameworks he uses in the book is the progress of medical knowledge from intuitive to empirical to precision. And his point is that early on in our understanding of a condition, an aspect of human health, our knowledge is intuitive and general in nature. And so we needed to build general hospitals that could do anything for anyone at any time. And so when we really started to build out healthcare infrastructure in the US in the early 20th century, that's what it was designed for. As our knowledge has improved over time, it moved into empirical. And for certain conditions, for example, ones that can be diagnosed and treated at urgent care clinics, our knowledge is precise in nature. In other words, we understand exactly what symptoms are for the condition and how to treat it. And that can be reflected within algorithms. So you no longer need a highly paid specialist to spend time on those things. And so to bring that back to AI, which is a new technology, or at least it's newly feasible with the Internet of Things and sufficient processing power. I think that some of the areas or the low-hanging fruit where we're seeing it implemented very much along the lines of what Adam was saying. It's optimizing administrative inefficiencies and fixing those and improving them. It's the things where it's less mission critical, say, than a life-dependent diagnosis. And sometimes that's what we read in the headlines about AI that will replace physicians. Anytime I hear that, I'm skeptical. I think that's a ways out, if ever. And personally, I don't believe that will ever happen. I think the capabilities of AI will improve over time. I'm not sure we'll ever get to general intelligence. And medicine is so complex that that really algorithms which are designed to do something specific really, really well may not be applicable for broad things. So let me just share two specific examples briefly of something that I think represents how AI is changing healthcare today in very clear ways, and then something that I think is futuristic. These things are in our portfolio. These are companies we've known for over a period of years now. And so one application that's working well today, and I'll skip Shift Health because we've already heard about that from Adam. But if you think about electronic health records with meaningful use, adoption has increased dramatically over the last 10, 15 years. And I think it's over 90% now of providers are using EHRs. And that happened very rapidly. So there are pretty severe growing pains with this. These are systems that really were designed for medical billing. And they function as databases, and they're built on software stacks that are technology stacks that are old from a usability, user friendliness standpoint. So one of our companies, Wellsheet, has developed artificial intelligence that sits on top of the EHR. So they're basically a button within Epic and Cerner that the clinician user clicks on, and it opens a new interface that they then operate out of. So it's an intra EHR tool that saves the clinicians 40% of their time in the EHR. So this gives them back a couple of hours each day. It also increases patient throughput by 20%. Their studies have shown, and they're being pulled fairly aggressively into health systems. So another example of AI that's making a difference today would be around patient communication and engagement that's remote, right? So not the front desk eye contact or time with a physician, but rather in between office visits. What are you doing to engage patients, or helping them prepare for a procedure, or delivering follow-up questions or instructions on how to get to the office. All of these kinds of things, which previously had to be done by front office staff, can now be largely automated. And one of our companies, Medumo, that sold to Philips last year, did this very well. I think more futuristic, one of our companies, Pathology Watch, is an example of a company that's doing a lot of systems integration up front to put dermatopathology images into the cloud. So that's not AI. They're getting paid to do this. They're doing well and serving dermatology practices. But on the back end, they're training AI to identify cancer in these images much better than a human dermatopathologist can. This is a laboratory developed test, so there's exemption for FDA clearance for now. It's not being used diagnostically yet, but it's a useful spot check. And in the future, the company it's anticipated, will pursue regulatory clearance. The challenge is they have to train these algorithms on a sufficient array of data and patients and devices that are imaging devices, because each of those variables, as they differ, can result in a different algorithm performance. So that's known as robustness, and the FDA is now requiring they have higher robustness thresholds for software as a device AI applications that they clear. So it takes more time, more money to train these algorithms now, but that's as it should be. Again, their performance needs to reflect reality as much as possible. So those are some thoughts on kind of the state of AI. There are things that are low-hanging fruit and mature today for AI, and many, many applications, dozens that we see that are creating enormous value for payers, for providers, for patients. And then things that are a bit more nascent and futuristic in nature.
Awesome. Appreciate that, Austin. And that's super interesting. I think I looked up at all our panelists, and when you were talking about the number of clicks it takes and the time we spend in an EHR and what wellness is doing, I think everybody kind of nodded with acknowledgement there on how many clicks. I spent some time with the front office administrator at one point, and we actually sat down and counted how many clicks it took to check a patient in. And I think I lost count after about 60 or 70 clicks. So it's a massive problem. Glad somebody's out there applying AI to solving that problem as well. And again, any questions for Austin? Let's post those to the chat window, and we'll try to get to those as soon as possible. Next up, I'd love to introduce Patty Jones. Patty is the Director of Revenue Cycle at Southwest Spine and Pain, a multi-specialty provider group with clinics and surgery centers throughout the Mountain West. Patty leads a talented team of professionals managing every aspect of the revenue cycle, from credentialing and contracting to cash posting. Prior to joining Southwest Spine and Pain, she's held several leadership positions with large health systems, including Group Health Cooperative in Seattle, Peace Health in Oregon, Baylor College of Medicine, and Houston Methodist. She holds dual bachelor's degrees in accounting and business management. And I'll add one more interesting thing as I've gotten to know Patty over time. She is wicked smart, and she could hold her own in about any technical conversation that we have, including AI. So with that, Patty, it's great to have you as part of the panel today. Would love for you to share a little bit with us about your 2020 automation journey and how your priorities are starting to shape up for 2021.
Wow, Lance, thanks for the nice introduction. I'm excited to talk with everybody today because this is a topic that I am so passionate about. So I want to give you some information about how my organization got started with Shift Health and the work that we're doing. And then I want to talk about how it's my responsibility to operationalize that, the impact of that. And then I'm going to spend a little extra time on the cultural impact of AI and bot technology in my environment. So I'll start with how we got started. I work for a mid-size, what you would call pain practice in Southwest Utah. We're not a big market, but we're kind of a vacation snowbird destination. Healthcare is in high demand here. We've had a lot of growth. Providers are short to come by here, depending on the growth of this area. And so we are growing leaps and bounds. And just like the problems that Adam experiences, revenues are not going up at the same pace as expense when it comes to rev cycle. So everybody in my role, everybody in revenue cycle is being asked to do a whole lot more with a little less and to create scalable growth. So I'm lucky. The board of directors that I work with actually elevated the rev cycle role to participate in strategy and board decision-making. So that's been a big win for the organization. The other part of this is that they are constantly networking. So our board of directors are working physicians who experience these pain points on a daily basis and have a lot of face time with patients. So they have direct conversations about what's meaningful with patients. They are always looking to improve administrative overhead expense so that we can spend it taking care of our patients in the best way. And our reviews kind of show that. And so what's been critical is that they're always networking to try to find new technology or new ways to make the admin processes scalable. They met up with Lance and Shift Health, and it was a very quick implementation decision-making process. And right away, we started scoring the wins. My group did a national search for a rev cycle director. They had the forethought to really focus on somebody who was comfortable with technology, as well as had lean process improvement background. So all of those combined have been sort of the secret to how we're able to implement much of the work that Shift Health has been able to develop for us. I want to talk about my journey a little bit. Working in large health systems, there are some learnings that I came across over the years. And one of them is that when it comes time to improve technology, there is a natural tension between revenue cycle and IT, and it's sort of siloed and adversarial at times in my experience. So everybody's asking to do a whole lot more with a little less resources, and because there's not a true partnership there, I don't think there's a complete understanding of rev cycle on the IT side. I'm talking about organizations that have hundreds of people in their IT department. The group that I came from had 900 revenue cycle employees. So these are big organizations that just lack the agility to partner in new ways, and the silos were very real. And so it's been fun to come to an organization where we're just a lot more agile. We're able to strategize, come up with an idea, and then implement it sometimes in as quick as a few days. So that's been the win. There's also, in the larger health systems, just more of a rigid structure. So I want the audience to think about how long it takes you in a large health system environment to even develop and create an HL7 interface. Just interfacing with all of your payers or partners can become something that takes months, years, and you can't get the win. So right away, Shift Health was available to help us speed up that process, and we could implement really quickly. Now I want to talk a little bit about what I call the secret sauce. And I think at some point they had a graphic where I could introduce you to Betty, our bot. I want to talk about the cultural impact of this. So let's think about this from the staff level perspective. We're a year into this pandemic, and there's just a heightened sensitivity and fear about our livelihoods, our health, our lives in general. And so this is Betty, by the way, so I'll get more into this, but we've taken a unique approach on how we've introduced this bot technology to our team. Betty's a coworker versus a tool or somebody who could replace them in their current position. But what's been interesting is that if we could take the work that staff don't like anyway, the low value stuff that Adam was talking about, if we can take that work and peel it off and automate it through this bot technology, we get the win, and it's a comfortable environment for people who get a little itchy and scratchy when you talk about AI or bot technology. I think it's important to eliminate those low value tasks and free people up and redeploy them on the higher value. So in my world, I'll tell you specifically, I have staff who have to spend a couple of hours a day manually attaching a fee schedule and hitting submit times 700 to get our claims out the door. It's sort of mindless, mind-numbing work that has to be done. And it's critical because you can't get paid if you can't get a claim out the door. So we've been able to automate those. Betty performs that work for my staff. It frees them up to perform more work on the back end or the follow-up. All of this insurance payer stuff that we have to do in revenue cycle gets more complicated every day. And we have to keep our staff well abreast of that, develop them, help them train. Remember, I'm in a smaller market, so I don't have the talent pool that I would in a larger city. So we've decided to make that more about development and higher level tasks that create engagement and wipe out some of this low value stuff. Another win for us, much like Adam expressed, was automating eligibility. So for every patient who comes to see us, we have to verify that they have insurance, what their copay is, how much their deductible has been met, and all of that. We've been able to automate that, saving 6 FTEs on the front end. For a mid-sized practice, that's huge. These are people in the clinics who were having to call manually, sit on hold, fill out forms, type things in the system about whether the patient was eligible for those benefits and actually how much they would cover. So those are some of the wins. You can see here the document they're displaying. I know it's kind of funny, but I actually created this and presented this in a board meeting just because it's our purposeful intent to make this a co-working situation with AI and bot technology, and not something that just lives in the vaporverse or somewhere. The board responded really well. We're getting the wins. When you think about this, you know, Betty, and we call her by her name, and I want to suggest that to everybody out there who's considering this. Naming Betty was a huge win. When we have our daily huddles, we talk about Betty as if she's a coworker. It really is our secret sauce. Betty works 24/7 when we need her to. She doesn't call in sick. She doesn't have a lot of personal problems, right? Now, our employees are wonderfully, beautifully flawed humans. We know that as leaders, and they add value in so many ways that maybe Betty cannot. But for revenue cycle, which is fraught with repetitive, lower value tasks, it's been a huge win for us. So one final thing, I want to talk about my learnings as we implemented many of these technologies. And I just want to say what a pleasure it's been to partner with Shift Health. Lance and I get on a call, and I've been encouraged by my board of directors to dream. So I'll have a crazy thought at night, and I'll get on the phone with Lance the next day, and we talk about possibilities, and really nothing's off the table. We find a way. You know, one of the biggest things that I learned working in the large health systems is we would spend agonizing hours, months, and years developing or creating or planning our technology, and it felt like we could never launch because everything had to be perfect. I want to encourage anybody out there who's considering AI and this technology, get the wins where you can get them. Launch. Sometimes it's been perfectly okay to test in a live environment. For eligibility, you have to, because you have to have real patients with real insurance plans. So this idea of just holding off until we've got everything we need would have set us back about 6 months. I'd say we're way ahead of the game because we're working on incremental improvements. If we can launch one payer's eligibility today and take the win, we'll check them off, pull one off the shelf, do another tomorrow, and get that incremental gain every single day. And that's how we've been able to operationalize in a really successful way. We didn't replace people with technology. I can't say that enough. The impact has been mainly in the front office environment in our 16 clinics or our 4 surgery centers. And those are the areas that typically have more turnover anyway. So these reductions in staff that you can see here have come about almost entirely by attrition. And then we have pointed those resources at either growth, because we're growing leaps and bounds and really had more work than we had people, or we're pointing them at the value-added process improvement. How meaningful is it to stop the 2 hours of mindless submitting claims and use those 2 hours to talk about our processes and really eliminate waste and improve them? It's been sort of magic in my world. I will say many of the tasks that the staff didn't want to do anyway eliminated their fears. In the beginning, everybody was like, what? We're going to have bots? And, you know, questions about, well, where are they going to sit? And we had a good laugh about that. You know, people don't have a really pure understanding in the operational aspects of this technology. Now it's every day. And I have a list in my office. It's crazy long because my staff are the ones recommending, can Betty do this? Can Betty do that? The answer is almost always yes. It's just how fast we can launch it. And I would say probably 19 out of 20 things launched well before I would have ever dreamed of launching them in another environment. One final thing, I think it's important for staff to identify their own pain points and participate in the journey. If we didn't make this Betty, like we have here that we enjoy, and had launched this in a different way, I think it would have been really off-putting and disengaging for staff who have that heightened sensitivity right now anyway. due to the pandemic and other reasons. I would encourage everybody to rethink every improvement you've tried to make over the years and kind of put it on fast forward, because I think you're able to launch this technology much quicker than you think you will. So Lance, with that, I'll turn it back to you.
Awesome. Thanks, Patty. Love the story. And I think we're gonna get into some of that a little bit more. I saw some questions come up, and we'll touch on those here in a bit when we get to the Q&A section. So we're going to jump into the panel discussion now and get into some of these questions. And I'm going to jump around here with the panel. And the way we've got this laid out is we've got about 3 to 5 questions. Hopefully we'll get to the bulk of those, and then we'll save some time at the end for the Q&A. But we've paired some of the panelists together in answering these, and so we'll allow each of them 1 to 2 minutes on responding and how they think about this particular topic, and then we'll move on, and we'll just see how many of these we can get through before we get to the Q&A portion. So just jumping around here, I think one of the ones I want to make sure we get to is getting to the point of helping an organization and decision makers make that decision. And I think looking at a lot of our audience here today, many of them are made up from or come from the world of they've heard of AI, they've heard of this technology, and they want to know what's the first step. How do we get to that point, and how do we get to the point of pushing this to decision makers? So with that, Austin and Patty, and Austin, if you wouldn't mind leading your response first. Here's the question here. So many decision makers understand the impact AI can have on their organizations, but they don't know where to start. What are some ways healthcare organizations can quickly deploy this advanced technology and help their decision makers quickly understand the value and the impact they can have? So Austin, with that, if you wouldn't mind just sharing a couple thoughts there.
Happy to. So I think, first of all, with consolidation in the among providers, healthcare providers, at least at the health system level, there's very few things that are quick in terms of a decision-making or purchase process for a new software that would go beyond a department. And even if it's within a department, it may need approval from, if it's a software product, from IT. And chief information officers and their teams are really, really busy. I've often found, having spent years in business development, sales for healthcare SaaS companies, that's where the bottleneck is. So I think there's a process. I think things that can be helpful from a organizational point of view is sufficient investment in process, just like the FDA has accounted for software as being different from, say, a medical device, as being different from a drug, and having a fast track process to clear software as medical device technologies, I think can be helpful for a healthcare organization. If there's a process for fast tracking softwares that again might be useful for optimizing administrative tasks, that's useful. And we've seen that happen. Massachusetts General Hospital, Mass General Brigham now, is an organization we work closely with. They fast tracked a number of things last year when the pandemic hit. I mean, took sales cycles from typical 9 to 18 months down to 2 weeks. So if something is an operational priority, it can happen. I think you can work agreements out with most of these technology providers, for example, a 3-month opt-out, so that it's almost risk-free. I mean, the risk is you spend the time on it and it doesn't work. But if there's sufficient evidence of a technology working, and you can see that in many of these cases, particularly with things like revenue cycle management or patient communication, administrative type work streams, the evidence is clear within 3 or 4 months. And so if you had some opt-out clause in your contract, we've seen that be an effective way to get started and run a pilot quickly.
Awesome. That's great insight. Patty, do you have any thoughts you want to add to that?
I do. I think it's best when you can identify very early on what are the low value tasks that are using your labor. If you have a menu of those. So when we started talking with Shift Health, we immediately started developing a list. Here are all the things our people are doing that are adding a huge labor expense for our organization, but they're not adding value. They're must-dos because that's the field I'm in. We have a lot of those must-dos. But when we had that menu ready, and I can say that in my weekly conversations with Lance, we have what's on deck already identified, the impact measured, and the idea of what future state would look like. And so I think once you make that decision to automate, it's very important to get the return on that investment by being able to launch the little wins early that add up super quick.
Yeah, love that. And I love the emphasis on the quick wins, because a lot of times getting to the point of taking that evidence and the proof of concept, if you will, to the decision makers in the organization, say, look, this is just a small example of what this technology is capable of doing. Sometimes that's just enough for them to say, yes, okay, let's move forward, let's put more resources on this, and let's go full steam ahead.
Lance, if I could add just one more thing. I think everybody in the audience will relate to what I'm about to say. Everybody has some super critical report that is people dependent. You've got one person who's responsible for generating this report that's the most important thing in the world since sliced bread. And we found that there is a great way to eliminate that people dependency and use this technology to put things on automatic. Then we don't have the concerns if we have somebody out and nobody's checking and everybody, it's not this find out after the fact, oops. And that's been a big win too.
Awesome. Love it. And I think let's jump in, and we've got time for one more before we jump into the Q&A portion. So this question is for Patty and Adam, and it's around digital transformation. So this concept of digital transformation has kind of bubbled its way up in 2020 throughout the pandemic, and it's happened across all industries. We see DoorDash, we see restaurants, online shopping, e-commerce. How is digital transformations impacted healthcare at your organizations? And especially would love for you to touch on how you've been able to leverage different point solutions at your organization and automated processes across those different solutions using this technology. Let's have Patty go first on that one.
Okay, well, I'll be honest. I've been working in rev cycle and healthcare for a while, and we've always been late to the party when it comes to technology. The whole claims process, scheduling process has always been sort of antiquated compared to what the rest of the world was doing in other industries. So what we learned, and actually COVID helped us with this. So in my world, I have 40% Medicare patients. So we've always taken this real quick hands-off view that, oh my goodness, Medicare patients are not going to interact with technology the way a younger population would. And that has been so untrue. So COVID forced us to perform telehealth visits with Medicare patients. And we found out that they love their smartphones, they're engaging with them all day long, and that we could improve our patient satisfaction by using a text format for a million different things. So our patients get a text reminder, which is now kind of industry standard, but we also send them a link so that they have all of their forms to fill out before their visit. We also send them directions to our clinic. They can click on them. After their visit, we send them a text for a review. And so this full cycle, and now we're able to receive texts from patients. So when they want to reschedule, let me tell you how hard it is to staff for phone volumes and phone calls. So We're converting our patients over to text technology, which they actually prefer in a big way. They will text us, I need to reschedule my appointment. I don't have my call center going bonkers trying to take those calls. You don't get to choose when a phone call comes in, but you can reply to a text at the same time you're taking a phone call. So we've gotten some labor wins that way too. Text has been the big difference for us. And our bot gathers all of our appointing information, sends one bulk upload so that we communicate with our patients. It's taken away so much people-dependent work from us.
Awesome. Now that's great. Great use cases there. And then Adam, you want to add some thoughts to that?
Yeah. I mean, when I got in the healthcare world about 12 years ago, I remember coming in, I didn't have really any exposure to the healthcare world. And I found out that our main mode of communication was the fax and the telephone. And that blew me away because, I mean, I felt like that was so long time ago. And so I feel like the healthcare world has always lagged from a digital transformation perspective, right? And generally we don't jump into it until we're sort of forced to do it. And the pandemic was a great example of that. I mean, I think telehealth has existed for a long time, but you can't get all the parties on the same page until you have like a pandemic that then forces the issue. And so then people start looking at, all right, how do we implement this? How do we make it a part of what we do? But as we've looked at, I mean, I would say so going back to my example of the fax machine, from day one, my thought process has always been, how do we transform ourselves digitally within the healthcare world to just improve not only like maybe back-end processes, but also improve the communication that we have with patients. And so looking at communication tools, looking at other software that allows us to do that is always what we've done. And I think if you have, I mean, you know, then the healthcare world a few years ago, 2000, I can remember 9-ish, 10-ish, 11-ish, EMRs, you know, were a big deal coming in and everything was going to be digital. And so, and EMRs were going to be able to do all this fancy stuff. And ultimately what it came down to was EMRs are a better way to collect information that are legible, but that's about where they end, right? They're sort of what I call a data repository. And so then you're having to look for additional technologies that allow you to take that data and make decisions and communicate with patients in a more effective way. And so looking at it, and so then as you look at that, you say, and every practice is different. Every practice has different processes. It's not standard across places. And so it's not a one size fits all. So you can't, I mean, there aren't a lot of technologies that exist out there that are going to work for me, that'll work for Patty, that'll work for whoever, right? And so it's finding those technologies that are a little more individualized for what we need, but then needing to tie that technology into our EMR or some other technology that we have, right? And so that's where you look at sort of this AI and the automation portion of it to say, well, I need something that can do that quickly, and I need something that can do that efficiently. And I want it to work in the way that I want to develop it such that it works for me. I don't want to take something that works for somebody else and try to then fit my processes to it. And so I think that's where the value of digitization in the healthcare world comes from. I think it comes more from these looking and making it more individualized versus sort of having the standard package that everybody uses.
Yeah, love that last comment there, Adam, where technology really allowing us to use our current processes rather than kind of conforming to some other standard that may exist in a silo within a technology somewhere else. And I think every organization, every healthcare organization that I've worked with in my healthcare career aligns with that same principle. Everybody's unique and everybody has their own business processes. Well, awesome. I think we've got about 5 minutes left, and so we're gonna skip the remaining panel discussion questions and go straight into to answering some questions here, and we'll get through as many of these as we can. And let's see. Jen, did you want me to go ahead and handle those?
Yeah, sure. I think you've got everything in front of you. There's one in the Q&A box. Let me go through that one real quick. About RPA and AI being game changers for RCM, remote monitoring. I'm saying that wrong, RCM activities, but can create some systematic issues. For example, RPA or AI automation at scale could result in submission of improper claims in large volumes. What have your organizations done in managing risk of submitting false claims in terms of human intervention and quality control? So it's probably for Adam and Patty.
I think from my perspective, Patty probably answers this better than I can. She's the RCM queen, but from my perspective, I mean, you just said it right there in the last, it says, you know, how do the terms of human intervention and quality control. Well, from my perspective, if you have concerns along that process, you build the human intervention and the quality control within that bot process. And so if you feel uncomfortable initially because you worry that that's going to happen, then you say, okay, what part of that process can I use a bot to automate? And then you start there, and that sort of, then you get comfortable with that. And you say, okay, what additional tasks can I add? And along that way, you might say, well, but this could happen, which could create this error. And then you say, okay, so if that's going to happen, then I want the bot to check for that. So it's like an algorithm. It says, all right, I want step A and B, and then I need to make sure I'm checking C. And at the same time, go back and check F and make sure you're looking at G. And so that's the beauty of a bot, is that you can build that. And the other beauty of it from my perspective is then not only can you build that, but then you're not bound to that. Meaning if something changes along the way or you find something out, you change that process. You change what that bot does. You add components, you take away components. So it's flexible and you're always adding and taking away from it.
Patty, you want to add to that?
Sure. I'll keep it brief, but I want to say that it's been important for us to launch in smaller segments. So we didn't take our high dollar surgeries and launch those first. We took basic office visits, picked just one location, launched it, audited it, got comfortable, had our controls in place, and then rolled out to other locations. And that helped us. And honestly, you know, I'm a wonderfully flawed human too. There were plenty of things that I didn't think of that we had to go back to the table and say, wait, what if a patient has this primary and this secondary, and these are bundled charges? And look, revenue cycle is complicated. And the one thing I can promise you is that it changes daily. So, you know, my advice to everybody is start with a small controllable population and then roll out after that.
Great. And we do have a question for Austin. So Austin, I think, you know, it would be interesting to hear from you as an investor. You probably see a lot of different AI ideas out there, you know, on top of all the trends about what you're seeing. Give us a sense of what you think is kind of overhyped right now in terms of the healthcare AI market, and what's kind of overwhelming and underwhelming.
Yeah, great question, Jen. Thank you. I think the stuff that's overhyped, as I alluded to earlier, things that replace doctors or the highest skilled providers of medical care with AI, anything like that, I think is massively overhyped. Just based on where AI is actually at. It's specific intelligence, it's not general intelligence. And much of medicine still requires general intelligence to provide. The things that are underhyped and completely low-hanging fruit is everything you've heard about today from Patty and Adam. This technology is real. It makes an immediate difference, and it's really exciting. It can save clinicians a lot of time, personnel a lot of time. It can add to an organization's bottom line and improve patient care ultimately. So I think from there, you know, if you look at technology like Wellsheet, they can go pretty quickly from presenting information more efficiently in an EHR and putting it back more efficiently into an EHR to clinical decision support and things like this. There's just so much data being generated in healthcare today by patients, and no human can process that. So I think that's going to be sort of a next frontier that we'll see, is assisting providers in caring better for patients.
So this is the low-hanging fruit, what we're learning about here today. So Lance, I think we're almost at the top of the hour, so I don't know if you want to wrap us up or give us some words to kind of go out there into the wild blue yonder with.
Yeah, absolutely. Yeah, just to close it up, just want to thank all of our panelists today and all those in attendance. You know, we're in a challenging time for our country and our healthcare system, and we're being asked to do more with less. And we're being asked to get creative and find ways to use technology to help us accomplish that. And so it's been so inspiring to hear these stories of